I really kind of thought of Planned Parenthood as probably just a stepping stone and as I started my career, but it didn't take long for that to change. It's just a good feeling to know that you're helping someone who may not have other access to health care.
I have always had access to quality health care, and it wasn't until I was in my adulthood that I realized not everyone did. And I thought that that was just wrong.
And if you can't get access, you can't get health care. We've also been able to extend services out into other communities, further outside of Waco that don't have any real healthcare choices for women as far as reproductive health care. And so for us to be able to make that possible for patients in some of the outlying areas and some of the rural communities, it's just tremendous.
Women's reproductive health is a cornerstone of family health in a lot of ways. If women can't take care of their bodies and their health, it affects not only them but their families. My mother was 38 when she passed away from breast cancer because she had no access to care.
I have so many friends who have come to Planned Parenthood and visited with the staff and the physicians, and every time they call me afterward and they say, wow, I wish that I would have gone there before.
There is a lot of misunderstanding and misinformation that states that we are in here behind these doors telling women what they should do with their bodies, and that couldn't be further from the truth.
People come in, they're treated respectfully, they're offered choices, they can come in and get birth control, they can come in just to get information. There are some people that come in and they don't even know what STDs are.
Anyone who would claim to be a compassionate citizen would want health care for other citizens, and being in opposition to that.
Waco is still somewhat of a small community in which you can see your impact more clearly than perhaps in a larger community.
If Planned Parenthood went away in Waco, there would be even more unintended pregnancies. There would be a lot more cases of breast and cervical cancer that go untreated and undetected.
They not only provide women's care, comprehensive women's care, but education. So it'd be like taking a library away, resources, information.
My parents understood the value of sex education as a child. As I transitioned into high school, I saw a lot of my classmates and my friends getting pregnant, and they didn't know about contraception, they didn't know what to do after they were pregnant, and so a lot of these women ended up having to drop out of high school. And that's when I truly became interested in Planned Parenthood and the work that Planned Parenthood does.
Planned Parenthood has been a trusted resource for families in the U.S. for over 100 years. And we have been in Waco since 1939 and have continuously operated since that time.
I have sometimes an easier time getting a hold of fancy cardiac medicines and chemo drugs and everything else there seems to be resources for. But I often have a hard time, and my patients often have a hard time, finding funding sources for healthcare for women, including PAPs and mammograms and birth control.
I want people to come in our doors and see what great service they'll receive, medically accurate health care, all the different birth control options that are not available in many places in our communities. I'm hopeful that despite all of the political climate that's going on, despite all the challenges that we have, that we continue to thrive and continue to, meet all those expectations that our patients have of us, and to exceed those expectations, and to continue to provide, the wonderful, great service that we provide here at Planned Parenthood.
Planned Parenthood's been part of the Waco community since 1939. Philanthropists have supported our healthcare delivery and education services for decades, and we're excited about the work at the Audre Rapoport Health Center and our continued investments in keeping Central Texans healthy.
Healthcare happens here.